Hi, my name is Megan Robinson, and today I will be talking to you and discussing the importance of being vaccinated for HPV. Most of us are aware of the most common STDs, and it can be harmful to our body and us, but most people aren't aware of the HPV virus and the future effects if it's not treated in time. According to the Center for Disease Control and Prevention, approximately 79 million Americans are currently infected with HPV. About 14 million people will become newly infected each year. HPV is so common that nearly all sexually active men and women will get it at least one type of HPV at some point in their lives. Today, my purpose is to inform my audience of the importance of getting the vaccine for HPV to prevent the chances of being affected by it. Getting vaccinated is one of the things I will be discussing. Being vaccinated helps prevent becoming affected by HPV and long-term effects that it may cause. HPV can affect anyone and also cause long-term health issues if not treated or taken care of. Unfortunately, there is not enough knowledge out to where people know the effects of what it can do and the importance of getting vaccinated. According to the Center for Disease Control and Prevention, there are approximately 40 types of genital HPV. Some types can cause cervical cancer in women and can also cause other kinds of cancer in both men and women. Other types can cause genital warts in both males and females. The HPV vaccine works by preventing the most common types of HPV that causes cervical cancer and genital warts. It is also given in a 3-dose vaccine. Some teenagers and young women visit their gynecologist for their yearly pap smear and aren't being educated on the vaccine to help prevent HPV. HPV vaccines cannot stop anyone altogether from contracting the virus, but it can also decrease the chances. It can decrease the risk of cervical cancer. It can decrease the risk of genital warts. Because any sexually active person is at risk of contracting HPV, if you get it before any sexual contact, you will be at less risk of either contracting it or passing it on to any future sex partners. Normally, the vaccine is given to young adults before they become sexually active. According to the Center of Disease Control and Prevention, HPV vaccines are recommended for 11 or 12-year-old boys and girls. It is recommended at this early age because young teenage immune systems take better to the vaccines and will allow it to work better. According to the Center of Disease Control and Prevention, there are 2 different HPV vaccines, Silverix or Gardasil, that can be given to girls and young men. Only one HPV vaccine, Gardasil, can be given to young boys and young men. Both Silverix and Gardasil protect against HPV types that cause most cervical cancers and have been shown to prevent cervical cancer. Most doctors also recommend if you do not receive the vaccine as an adolescent, you should get it before age 26. If you choose not to get vaccinated, there are other ways to assist you with not becoming affected with HPV. By practicing abstinence, by picking someone who has very little sex partners or none at all, using protection such as condoms, but not even condoms is known to have full protection against HPV. And also you can limit your own sex partners. Now that we have discussed the importance of HPV vaccination, let's get into the long-term effects. There is no cure for HPV infection. Although and most of the infection goes away on its own. Then there are some strains that may alternate your life if it isn't detected early enough to seek treatment. According to Rinse.com, researchers have identified 100 different strains of HPV, 40 of which can affect the anal and the anal and genital areas. Strains such as HPV-6 and HPV-11 cause genital warts, and these are usually considered low risk. HPV type 16 and 18 are responsible for the majority of HPV-caused cancers. There are the strains that are most commonly found and will stay with you throughout life if not treated. If cancers or precancerous cells are found early enough, they will contain procedures to help treat the virus before the cells can actually turn into actual cancer. A colonoscopy, which is done by a microscope to look at the cells closely. A biopsy, which is done only if the colonoscopy is abnormal. A piece of the cervical tissue is removed and to be reviewed by a lab. Depending on the results, if there is any chances of cervical cancer, certain procedures such as a cone biopsy, LEAP, or in worst case, a hysterectomy to stop any cancerous cells from growing. There are other strains that may cause HPV tests to come back positive. In most cases, these are very low-risk strains that will disappear on their own. If tested abnormal, the doctor, in most cases, will screen you every 3 to 6 months. Once pap smears come back normal, you will go back to regular annual pap smears. There is no way to avoid contracting HPV. Anytime there is unprotected skin-to-skin sexual contact, you are at risk if you're not being vaccinated. Unfortunately, there is no way of knowing or checking if you or the person you are having sexual contact with is infected with HPV. According to the Centers of Disease Control and Prevention, HPV is so common that most people get it soon after they start having sex, and it may only be found years later. Women who have ever had sex are at risk for HPV and cervical cancer. And to prevent from becoming affected by HPV, just make sure you see your doctor for annual pap smears. Make sure you have been vaccinated. And speak to your partner about previous sexual relationships. Now let's summarize. Getting vaccinated is important to prevent HPV. There are several strains of HPV that can cause long-term effects, as well as create stressful and scary moments in your life, as well as your health. And being aware and knowledgeable can help prevent contracting HPV. Fortunately, there are modern-day technology tests to help doctors define the different strains of HPV. I'm looking forward to our future, where there are certain cures to viruses such as HPV and other sexually transmitted infections. Thank you. You have a good day.